The Pope has a financial reform plan, sort of, and it is sort of radical. It was released by the Pope's Council for Justice and Peace last month. It calls for a Robin Hood tax on financial transactions, a tiny tax on financial transactions in order to shift money out of Wall Street, global Wall Street, and take that money and use it instead for development programs, for fighting poverty. Here in the United States, the Catholic hierarchy was not, as far as we know, out at the Brooklyn Bridge with the Occupy Wall Street protesters today. Instead of buckling down and getting to work on the Pope's Robin Hood tax and economic justice idea, America's Catholic bishops this year are instead re-upping their anti-abortion, anti-gay marriage, anti-birth control agenda. That is apparently what America's Catholic bishops have decided to focus on politically this year. And, you know, it is a good year for it. Republican politicians have been really focused on that stuff this year as well. Republican Governor Scott Walker of Wisconsin, for example, you'd think that he would have other things on his mind. After all, he is the focus of an attempted recall effort in his state. A new poll out this week on Governor Walker's prospects shows that 58% of Wisconsinites want him to be recalled from office. That's not good for him. Also, the unemployment rate in Wisconsin is at 7.7%, which is up a third of a point since he took office. So Governor Walker called a special legislative session on jobs in Wisconsin, and at their special jobs session, Governor Walker and Wisconsin's Republicans decided to focus on jobs by removing all discussion of contraception from the sex ed curriculum for Wisconsin school kids. We've been reporting on this for a while. Kate Shepard had a great piece on it this week in Mother Jones, noting that Pro-Life Wisconsin has been agitating for this. Pro-Life Wisconsin also says birth control encourages sexual promiscuity and with it a host of social pathologies. Contraception also prevents unwanted pregnancy. Is that a good thing? Pro-Life Wisconsin, we also found them on this familiar website. Remember these guys? The Pill Kills? Pro-Life Wisconsin was a 2011 The Pill Kills sponsor. These are the anti-birth control activists. Also, mark Pro-Life Wisconsin down for a yes on the Mississippi Personhood Amendment, which would have banned all abortion in Mississippi with no exceptions, as well as probably banning hormonal birth control and some fertility treatments. This is the thing that was promoted by Fox News celebrity Mike Huckabee, and which I guess sort of also has the support of Mitt Romney, the Republicans' leading candidate for president. Mitt Romney kind of half flipped back on that issue after it lost in Mississippi. He is still on the record saying he absolutely supports it. So, as with most things with Mitt Romney, who's to say what his position is really? Nearly 40% of House Republicans have signed on to what is essentially a federal version of the Mississippi personhood thing. So again, not just against abortion, but against the most prevalent forms of birth control in the country. And now there's an effort underway to essentially overturn, to create a really big exception to the part of health reform that requires insurance companies to provide contraception in the same way they provide all other preventive care, which is to say for free, without a copay. There's been widespread concern this week around Capitol Hill over rumors that the White House could be considering scaling back that part of health reform, scaling back that requirement that insurance companies have to cover birth control. That regulation and worries that the White House might be thinking about scaling it back was the subject of a Planned Parenthood alert and petition that's being circulated online right now. We've also spoken to multiple Democratic aides today on Capitol Hill who say that their bosses, members of Congress, are concerned. The White House told us today that no decision has been made on scaling back this regulation about birth control. Of course, no decision being made is not the same as we're definitely not changing this, which might be why Democrats on the Hill are worried about this in the first place. But clearly, the White House is trying to be reassuring, at least in terms of what they told us this afternoon. Joining us now is Congresswoman Diana DeGette of Colorado. She's co-chair of the Pro-Choice Caucus. Congresswoman DeGette, thanks very much for joining us. It's nice to have you here.
It's good to be back, Rachel.
Why do you think this provision in the Health Reform Act is important, this provision relating to birth control? And are you very worried that it might really be at risk?
Well, in August, what happened was the administration said that part of the required coverage of insurance companies under the Affordable Health Care Act is birth control. And that makes sense because that's preventative care. We're trying to shift the health care system to preventative care. And now the final regulation is about to be adopted, and there's been a hard push by religious institutions to say that Catholic hospitals, Catholic universities, other institutions should be able to refuse to cover birth control for their employees, for students at Catholic universities, and so on. And we think that's a terrible mistake, because we think that the people who have the conscience clause, who can make their decisions about whether they want birth control, are the women themselves, and they should be exercising this. This would affect millions of Americans, and so we just want to make sure we're concerned. The Pro-Choice Caucus is concerned that the Affordable Health Care Act continue to cover birth control just like it does any other preventative care.
To be clear, right now there is an existing exemption from this, which, as I understand it, is pretty narrowly targeted to religious institutions that is to say churches. And what is being considered, at least what religious groups, what Catholic bishops in particular are pushing for, is that exemption apply to all institutions remotely affiliated with the Catholic Church, which, as you know, would affect millions of people, largely through institutions like Catholic hospitals, Catholic charities, and Catholic hospitals and Catholic universities. Is that
right.
A fair assessment?
That's right. Many states right now, under state law, say that you have to cover, insurance companies have to pay for birth control, and they have a very narrow exception for actual churches. So the theory is, if someone goes to work at a church, they are likely to share the same precepts. But and so that right now is in the draft regulation from HHS. What we're concerned about is if you expand that to Catholic universities and to hospitals, number one, you're covering a whole lot of people who may not share those same religious objections, and number two, even most Catholics these days use birth control just like the rest of the population, and an overwhelming amount of Americans, including Catholics, support mandatory coverage for birth control in insurance plans.
When we spoke with the White House today, Congresswoman, they did really seem to be trying to calm things down here. I think it's fair to characterize their reaction to this as, listen, people may be upset, but there's nothing to be upset about. We haven't done anything. There are a lot of worries, though, and there are a lot of people who are upset about this. The American College of Obstetricians and Gynecologists, in particular, has been raising the prospect that this rule could be changed. Do you, from what you know of the White House and from what you know of them and working with them on this particular issue, is it possible that this is a misunderstanding and the White House is really not inclined to change this rule at all? Or do you think there is concern among women's health advocates on something like this because they are concerned more broadly that they don't know that the White House has a commitment to standing up for women's rights on an issue like this?
Well, look, I was the co-chair of the Pro-Choice Caucus when we passed the Affordable Health Care Act, and we saw what the bishops are willing to do with the Stupak Amendment that would restrict a woman's right to choose and other things. And we think it's much better to get this out in the open right now, to raise the issues, to let the White House know as they promulgate this final regulation that the vast number of pro-choice members, well, all the pro-choice members of Congress and the vast number of Americans support this kind of coverage under their insurance plan. We'd rather bring this out now because the concerns have been voiced than after a rule is promulgated. It's easier to do it now than after the horse has left the barn.
Congresswoman Diana DeGette of Colorado, thanks very much for joining us tonight. It's nice to have you here.
Good to be with you, Rachel.
Thank you.
Thanks.
All right, Moment of Geek, Missing Amphibian Edition, now with more disco and more hula just ahead.